And I think this collaboration that Commissioner Grove is putting together helps us look both triaging short-term and the healthcare crisis. It looks at what does a modified new norm on restarting businesses look like, but I think just as important, what does over the horizon look like? What does 12 months, what does 3 years look like? And I think that will come in conjunction this week, and we'll probably have an announcement in the next day or so of moving back elective surgeries to be able to happen again. I talked about that April being the cruelest month with those numbers. It was also a month of preparation. Joe Kelly and the team in the Emergency Operations Center, we went into April in pretty tough shape on terms of beds, things like that. That was, if you remember, the very first week of the stay-at-home order. We came out of April as well positioned. As I talk to people, we will have ICU capacity and ventilator capacity that is raw numbers greater than Illinois, with a population over 2.5 times bigger than us. So there is that side of it. But there's the other side that we're going to talk about, I think, in more detail tomorrow. I asked for and had our chief financial officer, which is the Commissioner of Minnesota Management and Budget, Myron Franz, asked for and put together a budget forecast. Those of you who are around this and you hear this all the time, we have a November forecast, and then we have the February numbers. Well, things changed dramatically from February till today, so we're going to have updated budget numbers to share tomorrow that will give us what the next year to the end of the fiscal year, or to the end of the biennium, looks like, and starts let us plan accordingly with the legislature and things that need to happen. So with that, I think we'll get some of the details of where we're at, and there's again, I would remind folks, as Jan shares these numbers, she will do it too. As you test more, you're going to find more cases. The real thing here is how sick are people getting? Are they getting the care they need? Are we getting them better? With that, Jan.
Thank you, Governor. Good afternoon, everyone. Here with today's situation update from a health perspective. Globally, as of early this morning, we had more than 3.5 million cases and 247,000 deaths around the world. In the United States, we are now over 1.1 million cases and approaching 68,000 deaths. And I think it was reported over the weekend that the death total from COVID has now surpassed that of the Vietnam War. Surely a sad milestone to note. Here in Minnesota, as the governor said, as of today, we are reporting 7,234 cases in Minnesota. We saw 1,000 new cases just over the weekend. So when the governor was talking about ending April, we ended April 1,000 cases less than we are as of early May now. So 1,000 cases over the weekend. Just over a quarter of all of the cases that we're reporting currently are coming from those 5 counties that are experiencing significant outbreaks surrounding food processing facilities. So that just really illustrates, I think, powerfully how quickly situations can change at the community level. And that is of deep concern, obviously, to all of us in the state. And the governor mentioned, too, our new total of 428 deaths in Minnesota. That was 33 increased deaths over the weekend, 24 reported on Saturday and 9 yesterday. Again, from yesterday's total, 7 of the 9 deaths occurred in residents of long-term care facilities. Among these 9 deaths were 7 in Hennepin County and 2 in Stearns. 2 people in their 90s, 3 in their 80s, 1 in their 70s, 1 in their 60s, and 2 people in their 50s. There are 396 patients currently in the hospital, 166 of them in intensive care. With the volume of testing going up, and we're very pleased at the progress, we had a little over 3,200 tests yesterday, lower than we did on Friday, but that's sort of the typical pattern during the weekend and Monday and Tuesday as test reports come back in. So we'll see those numbers heading back up over the next few days. But we definitely are considerably further ahead of where we were last week. And as we test more, we will find more, as the governor has said. So we're expecting to see those numbers on both fronts continue to rise, the testing volumes and the cases that are discovered as a result. As I mentioned, those 5 counties with current outbreaks are a source of a lot of work in testing, a lot of work in the healthcare system, a lot of work in the public health system as we seek to identify all of those cases, investigate them, interview them, find the contacts. And these are particularly challenging investigations, as many of the workers involved don't have phones, don't provide phone numbers, aren't answering the calls. So it's been a very labor-intensive, shoe leather kind of an approach. Working very closely and very grateful for local public health assistance in those difficult investigations. I just want to reinforce that as we are adding more cases each day, we continue to try to look for ways, and you'll hear more about this today and in the coming days, continuing to look for ways to safely turn the dial incrementally to open more business activity and, as we'll talk about tomorrow, more healthcare access, which is so important. But to make this work, we absolutely need Minnesotans to keep on focusing on those personal actions we can all take around social distancing. The stay-at-home order remains in place for another 2 weeks, and we really need people to observe that by staying within their household groups and only going out for brief errands or allowable business activities. Our teams at MDH, DEED, and elsewhere are working hard to develop safe reopening plans, guidance for settings and businesses to be able to increase economic activity, but in a way that doesn't further fuel community spread of the virus. That just is so important that we that the businesses are doing what they are doing to plan and prepare, to change business practices, to incorporate best practice guidelines about how to enforce social distancing, how to have enhanced screening, the critical importance of health screening for workers and customers likely. But for individual Minnesotans, we really need to keep that up too in our personal lives. And that means even with fishing open or coming home, coming up, staying close to home, enjoying those outdoor activities, but doing so with a minimum of travel is what is advised from a health perspective. We have to keep on keeping these good behaviors not only when we're going to work and engaging in economic activity, but when we're walking through our neighborhood or going to the hardware store or the grocery store. So thank you, Minnesotans, for the work you are doing to make it possible to continue to find ways to reopen our economy in a safe manner. With that, Commissioner Grove.
Well, thank you, Jan, and thank you, everyone. Good afternoon. As the governor has said, over time, one of the hallmarks, really, of us getting this process right to safely reopen our economy is really thoughtful planning. And from the very beginning, we felt like we're not going to get that planning right just inside of government trying to figure this out. We've got to be in constant contact with businesses, organizations, labor leaders, others throughout the state that can help us understand both the big picture, but also the very specific picture on how to get this right as we begin to reopen businesses over time and turn that dial carefully, slowly, methodically, so that we're keeping Minnesotans safe, but also growing our economy and making sure that we take care of people's livelihoods too. And so we want to take a little bit of a moment today to walk through that engagement process, how we're learning from organizations and businesses across the state, just to give you a picture of what we're doing, and then most importantly, to hear from some business leaders themselves about that engagement process to give you their perspective on this, so you can see a little bit of our process in action as we go through these days and weeks ahead. So, as the governor said, we are working with Minnesotans across the state on this response, and a lot of these conversations are, of course, virtual. They're over Zoom and WebEx and what have you. So a lot of in-person conversation over video conference, and a lot of surveys and tools that are used as well to take polls and understand from the perspective of different business owners and labor leaders across the state how we can get this right. Letters, emails, phone calls, we get a lot of incoming. We read all the incoming. We filter it to the right department to manage and respond. A critical part of this is making sure that we're being responsive as state government to the questions and concerns and ideas that are coming in from Minnesotans across the state. So in terms of how we're thinking about safely reopening the economy, I just wanted to talk through a little bit of some of the objectives here. And I think, as we've said since we announced the plan for reopening a few weeks back, we ought to be very careful and move carefully along that dial in terms of size, predictability, and contact type to ensure that we are carefully reopening the economy and looking at those factors that, as the governor said, incorporates public health, social distancing, and societal well-being. All of those factors play into these decisions. At every one of those turns on the dial, we are talking extensively to community leaders in concert, in conversation with them to make sure that we're mindful of that guidance. As you've seen in the first 2 clicks of the dial that the governor's made so far, each time we make a move on that dial to reopen part of society, it comes with a very careful plan in place. So the Department of Labor and Industry, DEED, the Department of Health, we have created these templates that are there to help workers and businesses stay safe. And every business and workers across the state have to determine the specifics of their plan that makes sense for their specific footprint. But there's some broad guidance there as well, really pulling from the CDC, pulling from MDH guidance to make sure that every business that reopens has that plan and can post it and share it with workers who come into their businesses and work every day, and increasingly now customers too, as customer-facing interactions will become part of these future developments. And then, of course, we're constantly monitoring progress. So we don't just click a dial and walk away, of course. We are constantly in conversation with organizations, with workers, with labor unions, with businesses to make sure that things are unfolding as planned. So very acutely and specifically, we're having targeted conversations with different business sectors. And you see some of them on the slide here. And it's important for us to have different conversations with different types of organizations because things are different in a church versus a business, versus a barbershop, versus a youth recreational facility, versus a small retail association. The broad guidance will always apply. We've got to stay safe. We've got to wear masks. We've got to stay clean. We got to make sure social distancing is in place. But that plays out in different ways in, say, a gym than it does in a church or in a restaurant or in a bar. And so we're having these targeted consultations with trade associations, chambers of commerce, labor organizations, industry leaders, faith communities that really get quite specific. I mean, we're getting into the weeds of this stuff. How does it work in different settings to get social distancing right, to get health screening right, to make these moves carefully? Beyond just these conversations, we're also using data. And so we've had a survey out there. We've reached almost 8,000 organizations across the state with very specific polling questions on exactly how to get social distancing right, how it's playing out in workplaces that are open, what we can learn from the experiments that are taking place out there in critical sectors today. And you can see here on the slide just a kind of a picture of the types of organizations we're talking to. Professional service organizations, manufacturing, retail, healthcare, arts and culture, government organizations, of course, education. We've been talking for months there, bars, restaurants, and hospitality organizations, community organizations, nonprofits, and a whole host of others. So as I said, we're talking to about 8,000 people via this survey that's quite detailed. And just to give you an even greater sense of how detailed it is, this is a bit of an eye chart. I don't expect you to be able to read it, but we are getting really specific on industry type, right? So healthcare, it's not just healthcare writ large. It's hospitals and clinics, it's dental offices, it's medical offices, it's chiropractor offices. There's some specificity here that's critical. So that survey's been a critical piece of feedback for us as well. And then in addition to these targeted economic conversations about business settings and organizational settings, we are talking to other groups who are giving us wisdom that builds into this guidance and these plans. So we talk very regularly with the tribal leaders of the 11 tribal nations who share geography with Minnesota. Advocacy groups and nonprofits. DEED does a call about 3 times a week with these organizations to help both share information but also get feedback. We've been doing weekly and bi-weekly calls with the chambers of commerce and trade associations, economic development authorities, consumer advocates for older adults and people with disabilities, disability service providers. That's a critical market that having conversations with matters. And you can see more here, labor unions, long-term care providers. All these conversations take on different complexions based on who we're talking to. But we want to just take some time to share who it is that we're engaging with, to give a picture of how expansive this needs to be for your government to serve you well. And so this gives you that picture of the groups that we're engaging. And lastly, on this point of feedback, I would just say this. We want to hear from every Minnesotan if we can. And so, to be one Minnesota, we got to hear from all of Minnesota. And so there is a survey up on mn.gov/deed/safe-work where any Minnesotan who would like to is submitting thoughts to us on how to get social distancing right in a lot of different contexts. We compile that every couple of days, and we're looking at those submissions, and it really is helping us navigate this effectively, and it's helping the governor understand how we would get this right when it is time to make further expansions and loosen some restrictions. So this is an important part of our process. We wanted to go into some more detail on it today. And as the governor mentioned a moment ago, even though in the short term we've been very focused on critically important sort of crisis-oriented metrics. We're looking at hospital care and PPE and healthcare worker quotas and of course tracking the epidemiology of the disease. We can't wait until it's over to start planning for the longer term. And so later this week, you're going to hear a bit more detail about a new council the governor is pulling together called the Governor's Advisory Council for a Safe and Inclusive Economy. And this is something we want to start now because we have to be thinking longer term right now about how Minnesota's economy is going to bounce back from this and how we can make an even stronger economy on the other side, because we are going to recover from this crisis. And we need to be learning from the best minds in the state, the best leaders from a variety of different sectors to ensure we're giving the governor the best advice he needs to make thoughtful decisions. So this council is going to be made up of industry leaders in business, labor, higher education, academia, the legislature, DEED and DLI, our Department of Labor, will play a leadership role here with the governor in supporting him. And we're going to be asking questions in the medium term. What is it going to take to rebuild our economy? How can we reskill our workforce for the jobs that lie ahead and retool some of our tools inside state government to make sure we're re-engaging workforce in the right way? How do we reimagine workforce development for the 21st century? Is it all brick and mortar? Are there digital tools? We need help to make sure we can navigate that right for Minnesota businesses. And then in the long term, of course, we're asking some bigger questions. How can we reimagine Minnesota's economy in a way that is more equitable and inclusive than ever before? We all knew the disparities that existed in the state going into the crisis, and the crisis has made many of them worse. As you've heard the governor and lieutenant governor say repeatedly, we've got to have the right strategies in place to make sure coming out of this, we bounce back even further for those who face the biggest challenges. So these are the kinds of questions that you'll see that council address. We're eager to address leaders across the state in that effort as we think both about this short-term kind of reopening and safety preparedness for the crisis at hand, and then longer-term about our state's economy and all that lies ahead. So wanted to give that preview, but most of all, wanted to give you a chance to hear from some of Minnesota's leaders in this space. And so we're very thrilled today to be joined by Abdirahman Kahin and Liz Raymer. Abdi is the CEO of Afro Deli, an amazing business. Abdi himself, an immigrant who has built an extraordinary business here in the Twin Cities and has done much for the community in addition to innovating ways that his business can survive during this time, and has given us lots of great advice. And then Liz, as the governor said a moment ago, runs Hospitality Minnesota, an incredibly important trade association who has given the governor, myself, many of the leaders in state government lots of advice on how to get this right moving forward. So we'll have Kahin come first and then Liz after that. Thank you both for coming today.
Thank you, Mr. Governor. Thank you, Grill. My name is Abdirahman Kahin. I'm the owner of Afro Deli and Grill. It's 5 restaurants in the Twin Cities and a grab-and-go line where we provide grab-and-go to gas stations and convenience store at the airport. And as a small business owner and community leader, I have seen a lot of the last years. But this pandemic has presented new challenge for my business. Through it all, we continue to focus on the health of our employees and customers. We appreciate Governor Walz and Lieutenant Governor Flanagan for their steady and strategic leadership. They know the most important priority is the health and safety of Minnesotans, and we believe that too. I have been with Governor Walz and Commissioner Grove strategic leadership to chart the course of how we reopen Minnesota business or Minnesota economy. These are tough decisions, but they are listening to my feedback and the suggestion that I'm giving on the table, and also the listening also the other businesses across the state. It's important as we develop a plan for reopening in a safe way that protects employees and our customers. And I appreciate the leadership that the governor and his team are doing for Minnesota. As a small business with 5 restaurants, only 2 restaurants are right now operating, and we are ready to implement with the new guidance of the governor and his team. It's going to be very tough, but the safety of our customer and of our employees is very important. We will adjust, hopefully, for the next few months, how we're going to operate in a safe way, so we protect our lives and our customer life. As you know, this is tough time, but 2020, if we go through safe and healthy, it's a profit for us. So we will be ready to go through this. And as a Minnesotan, we're going to stay strong, and we are this together. Thank you very much.
Liz, thank you.
Hello, I'm Liz Raymer. I'm the CEO of Hospitality Minnesota, and our organization represents more than 2,000 restaurants, lodging facilities, resorts, campgrounds, outfitters, and many more. Many of these are independent, family-run businesses that employ right now 300,000 people throughout our state. It's a very big industry. And I want to thank today Governor Walz, Commissioners Grove, Commissioner Malcolm for their great leadership. We really do understand that this is very complex, and there needs to be thoughtful care and consideration given to all parts as we address this today. We want to thank you, too, for acknowledging the monumental hit that the hospitality industry has taken on in the face of this crisis, and really the work that so many continue to do to feed and to lodge people, to keep people upbeat and happy, even during very tough times throughout our many communities in Minnesota. We're confident that Governor Walz and his leadership team understand the dire consequences our industry faces right now. We know from our recent survey that more than half of these businesses face certain permanent closure in the next 2 months on the current course. We share the common goal to protect and support both the public health and our economic recovery. The hospitality industry is vitally important to Minnesota, both its economy and its culture. These businesses are who we are as Minnesotans, and they're the fabric of our communities throughout our state. We're confident, too, that our hospitality businesses are ready to open now. Our businesses and the public, they're ready to approach this new normal. They understand that there's going to be need for promoting effective social distancing, enhanced sanitation processes, and ways to engage with one another in a meaningful and safe way. We know we can achieve the same or better and really understand the level of predictability and safely as other businesses with the right protocols and the public commitment. It really is a two-way street. So to that end, we're working collaboratively with the governor and his team to finalize guidelines for this industry, drawing on the expertise of our membership, the guidance from federal and state agencies, and the expertise of our industry colleagues around the country. We have the great advantage to be able to take information in from many parties throughout the country and from different organizations that help us understand these protocols and the needs going forward to protect our communities and our employees. We also know that unless these businesses receive support that really better reflects the needs that the current federal programs offer, many will simply not make it. Reopening won't be sufficient. These businesses really need an extra hand up. We also know we need to work hard to build consumer confidence to a successful outcome, and that's going to be key in this two-way street. 300,000 jobs in Minnesota depend on us getting it right, and they hang in the balance. The community experience that we know and love, meeting friends at a restaurant, welcoming guests from around the world at our many great hotels and motels, spending a week at the lake resort, returning to a community or a campground, and of course, access to our wonderful Boundary Waters canoe area. These are all also hanging in the balance. So we need to get this right to bring these businesses back to full health, and we're confident that we can do that beginning immediately. So in closing, we really look forward to working with Governor Walz and his team to finalize best practices, confirm a reopen date with adequate notices so that businesses can prepare and really secure, again, economic relief that these businesses so desperately need. Thank you.
Thanks, Liz.